Is a really important webinar. Actually, the reason why I say that is because a lot of people don't really realize how important. Hey, today is a really important webinar. Actually, the reason why I say that is because a lot of people don't really realize how important. So, really, at the end of the day, is so important. Why I say that is because a lot of people don't realize nerve damage can be a serious issue for many people if they are diabetic. So net result, a lot of people just kind of not really understand that, and matter of fact, many of them even ignore that issue. So net result, they can be a serious problem without knowing. And so that's the reason why I thought that today we especially create a lecture really for that. And so you will have a really good understanding what is nerve damage is all about. And I think this is going to be an extremely good webinar for everybody. And so you can able to understand what it is. So let's dive deep into this area. So let's start. Okay, I think that everybody already able to read the slides now and see. If you can hear, just let me know. Make sure that so we will able to continue our webinar. Okay, today we'll talk about if you are pre-diabetic. A lot of people say, "Well, I'm okay. I'm just pre-diabetic, no issue." But then a lot of people don't realize, when you talk about pre-diabetic, actually they already start having some effect of the nerve damages, and that result of that throughout, the nerve damage that continue throughout the process for the whole body and continue to start damaging. So even a pre-diabetic patient, usually they have some sign and symptom or sometimes no symptom, but the nerve damage already starting. And if you're diabetic, this nerve damage is already actually is there for a while. So it is even more so you got to start doing something to help them to minimize this nerve damage so you can able to continue to healthy and not much diabetic complication. So today's lecture is really talk about the whole thing, how you get your pre-diabetic to diabetic, start getting to nerve damage, and how important that is. That's why I thought today's lecture is extremely important for you to understand so you can able to really practice and do a lot of prevention. So let's start. Okay, now today we'll talk about, how connecting the nerve to pre-diabetic, diabetic, how does it mean? What does it mean? Okay. So, and what is the early sign to watch for and how just simple lifestyle. And today we're going to talk a lot about how the lifestyle, like in the food intake, exercise, all that, to help you to reduce this nerve damage and how low sugar can help you. And so today's lecture is very full and we will dive deep and is extremely important for you and you'll be very you after you know that after you finish the lecture you say, wow, I didn't realize that. And I'll give you a lot of example because I have a lot of patients that will come back to me and say, Andrew, I'm not pre-diabetic, how come I got all these feeling? I said, hey, that's where you start getting slight tingling feeling, dry skin, and things are starting. And that's something that you really got to start off by lower your blood sugar and decrease this nerve damage so you don't get worse and worse and worse. Okay, and how at the end of the day this nerve damage can actually damage enough that you can actually remove your independence and you can walk, you can eat, you can button your button. Wow, it's terrible. So I want you to make sure understand the whole concept so you can start preventing this nerve damage. Now, today I have a lot of people that I don't know the name. I believe that they basically probably are new to our organization, so we always catch up. So diabetes is always go with started with 4 stage. From stage 1, the LDL cholesterol increase, damaged B cells coming out from the pancreas, B cell takes sugar to the cell, the B cell damaged, so no sugar, not limited sugar going to the cell, so your blood sugar will continue to increase in the gut bloodstream, more and more sugar. So LDL cholesterol, blood and blood sugar get together, the blood becomes thick, and you start forming plaque all over the vessel wall. Now, when you get all over the Western world, the problems start because they will block all the blood flow going through. And you know what? Your blood pressure will go up. And as time goes on, discontinue blood, you can have all kinds of diabetic complications. That's the reason why it's so important. You will prevent, and diabetes is a whole disease, is blocking all these vessels. So even blood pressure go up, you have no, signs and symptoms. So you continue your lifestyle. Okay, no problem. But as time goes on, that will become a big problem for you. And very quickly, you move down to stage 3, which is called a pre-diabetic. And everybody have the same thing with pre-diabetic. And every doctor will measure you with this test called HbA1c. Now, HbA1c is basically everybody have hemoglobin, and they measure how many percent of sugar attached to hemoglobin. If you are 5.7 and below, you're a normal person. If 5.6 to 5.7, 6.4, now you're pre-diabetic. Unfortunately, the doctors say, hey, you're pre-diabetic. I can't give you much medication. You got to change your lifestyle, like low carb diet, low fat, exercise, lower your weight. And so basically, you listen on that. Oh, okay, that's real good. But you don't use your practice. That's one thing can help you. Low sugar, which is lower your blood sugar, cholesterol, and blood pressure. That is something definitely work. Now, if you don't do anything, in about 2 to 3 years, you will change to diabetes. And when you get a diabetic, you can come back. The symptom can go back, your A1C can go back, but your record will be still a diabetic. We have helped many patients with the A1C even as high as 11 or 12. They brought it back down to 6.4 and below. So that's something you can do. And why low sugar tea? Okay, no problem. Low sugar tea basically have two things in there. One is that they have guavatives delay the sugar going to the gut vessels. Two is that bitter mat increase the insulin sensitivity, take the sugar back to the cells. Excess sugar, excess LDL cholesterol, and salt, they'll dump it off the urine. It doesn't reabsorb. So net result, your salt go down, your blood pressure will go down, your sugar go down, and your LDL cholesterol go down. So that's really naturally. It's not a drug. It is just a supplement. It's a food because they only have guavative and bitter melon, two things, but it does work. Now, we don't want you just to drink low sugar tea. We want you to also change your lifestyle. Now, changing lifestyle take half to a year, seriously, because you have to now start looking at all the food you take. It will be low carb, low fat diet. So it takes time to adjust. You have to exercise. Exercise means 8 to 10,000 steps. And a lot of people say, hey, I can't do 10,000 steps. I can't do it. Oh, it's okay. Do 3,000, start it at 4,000, 5,000, all the way up to 10,000. If you still cannot do it, because a lot of people say in Hong Kong it's too hot, I can't walk. Get a step master. You walk like that, and you can walk 10,000 steps on a step master. Wow. Even half an hour, you get lower 360. You can actually lower your calories. Basically, burn 360 calories every time to half an hour, and it will definitely lower your weight. And with that, you can also with a barbell go up and down like this, and then you move the upper extremity and do this. Now you say, oh, I don't have money to buy a step master, which is only cost about $50 US or $300 Hong Kong. No problem. If you have an armchair, you just go up and down like this, sit up and down, go up and down, go up and down. And you can do 100 times. You can do similar effect 100 times. If you do one time a week, one time a day, or 3 times, if not, you can do slowly. Every day you do that for at least 2 to 3 times, 100 times, just sit up and down. That will help you to strengthen your knee, strengthen your leg muscle. So when you go older, you can walk. That is the most important. You can walk. You don't fall. You strengthen all that. Now, you don't do that, your muscle is not going to get better, weak. Plus, with that, you lower your blood sugar whole day long. So anyway, I have also lectures here. If you want to review all the lecture we have now 460 lecture. I think we're the only guys in the world doing 460 lecture in free for you to listen. Okay, so this is really a wonderful thing. So anyway, do actually do do your exercise, and that way you can definitely, and also you look back on all the lecture, if you need whatever topic is, definitely is there. Okay, so what is pre-diabetic? Now, earlier I told you a lot of my patients actually they are pre-diabetic diabetes. They will come to me and say, "Hey Andrew, I have this problem, man. I have all this tingling feeling and all that." So I said, "Hey, no problem. You need to continue to basically and go into all these exercise, diet, control, drink low sugar tea to help you prevent the further damage of your nerve." So pre-diabetic, I mentioned already, if you have 5.6, 5.7 to 6.4%, if the amount of sugar attached to your blood red cells, if you have that, man, you are already pre-diabetic. Okay, with that, your blood sugar is now high normal, but not yet a diabetes yet. But a lot of people, unfortunately, they don't have any symptom. They basically just got to the doctor office. Oh, I am a pre-diabetic now. And millions of them actually don't even know. Some even have diabetes, they even know. So usually all these people are age 45 and up. They might have family history and maybe have big belly. They may have high blood pressure, high cholesterol, lack of exercise. All these are people are usually have that problem. The reason why is they don't move much. The insulin resistance continue high. So as time goes on, if you don't do anything, as we talk about, you are changed from the pre-diabetic and going to diabetes. Now that's not good. So why we talk about all these things about nerve damage? Seriously, what related? I thought nerve damage is really only for people who are deep into diabetes. Not true. Really, at the end of the day, you have to have high blood sugar damage to the nerve is started, even you're pre-diabetic. So basically, the reason why you have that, imagine the nerve is like a bunch of telephone lines going from your body to throughout the whole head, all the way to the whole body. And there's a lot of tiny little blood vessels in there. And this blood vessel, because high blood sugar, it start getting damaged. And when it get damaged, it decreases the oxygen and going to the nerve, and the nerve is start going to be really start damaged and not function well. Because of that, you're going to start getting whole body start inflamed. And the nerve is hard to repair. They repair very slowly. So net result, they affect the communication between the brain and the body throughout the body becomes slowed down. So usually affect because the most affected area will be the hand, moving hand, your leg and your foot usually start first. So net result, don't think that wow, hey, I'm only a I'm only a pre-diabetic. It doesn't affect me. That's not right. It's not true. Does affect you. And also the thing about it, the high blood sugar actually increased inflammation throughout the body. So this chronic inflammation contribute to cellular damage and then slow body ability to repair all the injury of the nerve. That's why it becomes slow, okay? And also elevated blood sugar is also, there's another issue. Oxidative stress. And oxidative stress create a harmful molecule called free radical and build up as you go on. And the body will be hard to remove them. Then this molecule will actually damage the nerve cell and surrounding issue. So over time, all these effects, that's why it cause the nerve become less and less sensitive. Initially, people don't really notice, or they will feel some tingling feeling, some occasional numbness, and damage continue to progress. So symptom will continue to grow and more severe, including burning sensation, burning pain, weakness, loss of balance, or sometimes even complete loss of sensation. We have a lot of diabetic patients actually have no feel. They can't feel the hand. They can't feel the actually when touched. They don't feel it, and that is created all kind of problem because if they are continue maintain high blood sugar, all the nerve become really getting more stress, and the body getting less and less control because nerve is control the body, right? You can control. So later on, you're going to further get less than dependent. So independent. You cannot independent anymore. That's why I want to talk to you and get you to understand and build up this understanding so all better sensitivity. So why nerve damage can start early, even you are pre-diabetic. Now, a lot of people actually hold is really misunderstood. Oh, I'm only pre-diabetic. I should have no problem. However, new research show that you really have early pre-diabetic. You can have early nerve damage because all these small fiber from the nerve ending to the small vessel, it start getting injury. And then with that, because all this nerve fiber basically is help you to feel the heat and feel all the item that you can touch, burning sensation. Supposed to you can feel those burning sensation. Now, if all this small nerve fiber vessel to this small nerve fiber damage, then you're gonna have issue of feeling you don't feel, or you will start feeling funny. You got burning sensation occur, tingling feeling, and worse that you really start getting your balance, because nerve control your balance and also control your muscles. So you might have balance might be worsened, and some people even at the end, they will get worse and worse and worse. Now, some people, especially pre-diabetic, might not have no feeling, no symptom at all. So they thought that's why a lot of people said, "Hey, I'm pre-diabetic, I should be okay." So at the end of the day, although you don't have all these tingling feeling or burning sensation, but it doesn't mean the nerve is not damaging. The nerve is continue being damaged. So as time goes on, you are continue to get worse. So one day you're gonna feel that effect more and more severe, even as a pre-diabetic. If you become diabetic, you get worse and worse and worse. Okay, so that's the reason why I thought that perhaps get you a better understanding, the whole idea why you have to worry about nerve damage as a pre-diabetic and a diabetes. Now, you heard about a lot of people said diabetic neuropathy. In other words, diabetic actually is damaging your nerve, and it causes high blood sugar. And 50% of people in diabetic are affected by this disease. In other words, 50% of people who are high blood sugar and they become a diabetic or starting to be a pre-diabetic, they will have the diabetic neuropathy. You mean damaging the nerve. Now, there are 4 types of nerve to be damaged, and I'll go through this a little slower, and so you can understand that. And usually, majority common is the peripheral neuropathy. In other words, it affects your feet, your hand, all that. But I will dive deep a little more because this is important to understand. There are few effects. Most common, as I mentioned, most common type is peripheral neuropathy. Usually begin with the feet, the leg, before progressing to the hand. Now, people who usually describe the type of effect is tingling feeling, burning sensation, electric shock, reduced ability to feel injury. Now, that's the reason why many people who are diabetes, the injury, they cannot understand, they don't know, they don't take care of it, and become worse and worse. The infection become overtaking the whole area, and at the end of the day, you have to cut out your foot. That is the reason, because they can't feel, so they don't treat it. Okay. Now, the first type of nerve damage, as I mentioned, peripheral is the hand, leg, actually leg, and you eventually get to the hand. The second type is called autonomic neuropathy, meaning that the nerve control the entire body, such as digestive system, and the heart rate, and the blood pressure, sweating, bladder function, bowel movement. Now, when these nerves become damaged, people may experience the first thing, constipation. And a lot of people have constipated, come back, I can't go, I feel cold, I cannot go. Hey, we just gonna have a lecture, just talk about constipation. So maybe you can look at last week's lecture. That's what I did. I talked a lot about that. And also, why there's constipation? Because what happened is damaging the nerve after the stomach coming through and going to the small intestine. Those nerves are damaged. So the stomach empty, it becomes very slow emptying. So the stool very difficult coming down. And then you also may start getting dizziness when you're standing. A lot of people have bladder problem, and then they change sweating. Now, bladder problem, later on we'll talk about, is a lot of people get the bladder problem, they get more chances of urinary tract infection. So the third one is called proximal neuropathy, which is affect your hip, thigh, your buttock, causing weakness and pain. And focal, and the fourth one is called focal neuropathy, which is affect your single nerve, causing sudden weakness and face, eye muscle, and hand. Okay, now all these important nerve damage is always cause pain. Some people gradually lose the feeling, and they particularly dangerous is they don't notice. So they actually, one of my patients said, "Oh, I just want to touch the bath water. Is it really hot? Can't feel." So she burned all her foot because it's so hot, cannot feel. Net result, she actually almost lose her foot because of that. The whole thing is burned up. Okay, now this is only early stage diabetic. She had that problem already. So it injured her feet and it actually increased the infection and ulcer. So I dive pretty deep on that to let you know the 4 nerve damage, and that's important to understand. I think if you do that, you can now see the seriousness of that. So you're gonna start getting warning sign, right? Now, maybe you don't get warning sign either, but there's sometimes you do get not warning sign. And that warning sign is you're gonna tingling of the feeling. I mentioned a pin, like needle stick putting at your foot, and then you're burning feet, you have numbness, you have sharp pain on the back heel here, and then you can start getting total insensitivity and you start getting weakness. Now, getting weakness is important because if you're older folks, you will fall, and then you will actually get really issues in mobility, and you can't walk anymore, especially you are 70 years old, you cannot walk. Man, that will be terrible, and you don't want to do that. So you want to make sure that all these are taking care the nerve, and make sure that it doesn't have that issue. Now, muscle weakness, a lot of people don't understand or they don't even think about. And if you have nerve damage, you could have another symptom is called muscle weakness, because the muscle is controlling by the nerve, and they become damaged. So you have difficulty actually even walking up to the stair, standing in a chair, maintaining a balance. Now, if you have that problem, imagine you cannot walk, you cannot stand, you go around the street, you might fall. That's a tremendous problem, right? So if you have some of this early stage, many people notice just kind of occasionally, and usually they said even evening, bedtime. So a lot of times the symptoms kind of disappear. So they even ignore, they forget about that damage. So they don't take care of it. But if you actually feeling this symptom, you really have to don't ignore it. You have to actually talk to your doctor and start getting better understanding how's your blood sugar issue. Is there something management you have to start getting serious to get managed? So really, at the end of the day, that's why I want to take this lecture in dive deep a little bit, so you understand if you have this problem, burning sensation, numbness, sharp pain, increased sensitivity. So all that you can basically you gotta start talking to a doctor. Now, don't take it lightly, because all that symptom will eventually affect your daily life. You end up will be difficult walking, going downstairs, even buttoning, you will have difficulty. You start losing balance because the nerve somehow just doesn't give you all the muscle sensitivity to go you to walk. So you start losing balance. On top of that, you will fall frequently. Now, elderly, like 60 and to all the way 80 years old or 90 years old, you fall, you most likely have a chance of broken bone. A broken bone, you know what? You're going to be immobility. Immobility is going to make things really worse. You're going to go to a wheelchair. You can live on your own. You cannot walk. You can take care of yourself. Or even reduce a group of strangers, open a bottle. So imagine that. All those will be so difficult. So you don't want to be in that boat, man. I tell you, I have a lot of patients actually come back and say, gee, I really having this problem. I said, well, get aggressive to treat it. So start doing exercise, drinking low tea, eat vegetable, those things, at the end of the day, 4 or 5 months later, say, oh, you really helped me. Well, that is what happened. So you got to start taking that step. Now, I want to let you know the nerve is like a telephone line from your head all the way to the entire body. And this telephone line is so important. If you really if nerve damage, they usually have pain, numbness, hand or feet, and nervous is considered to help you to feel all the information. If you have really nerve working, they will actually give you to tell you that, oh, I have touching that I can feel heat and all that. But if this network of autonomic nerve that now control the essential all the function of the body start damaging, so you might even affect your heartbeat, affect your breathing. Even every meal you eat, the digestion will be affected because you know what? The empty here, this nerve here, that actually will slow down the digestion. So your fecal matter doesn't come down to the gut slowly, so you don't get digested. Net result, you're going to get constipation. So it will have variety of damage that can go on. So in digestive system, as I mentioned, the food doesn't come through the stomach to intestine slowly. So you have constipation, you have bloating, nauseated, feel full whole day after just eat a little because just due to delayed stomach emptying. So the autonomic nervous system affect the heart, the blood vessels. Some people experience dizziness, standing, and blood pressure does not adjust quickly enough. So others have changed the heart rate and reduced exercise tolerance. All that will come. Now, the thing is also with bladder, the damage to the bladder nerve. So net result, your bladder empty also being affected. So it will also increase the urinary tract infection because the bladder doesn't empty enough. Now, also a lot of people don't realize because of that, they also have a lot of that has sexual health is also affected because you can't feel. And so net result, you have normal sexual function, you'll be totally wiped off. 30% of people have basically has no sex because of the fact they can't feel it. Okay. Also, it changes sweating, and that overlooked symptom that a lot of people don't know. Some people sweat excessively, some people a little bit, but it's hard to make the body to regulate the temperature because this kind of symptom is variable. You know where you come from. Gut, sweat, bladder emptying, sexual function, and then you have blood pressure issue, and then you have heart issue. Man, all kind of issue come along. So you really need to understand diabetes can affect nerve throughout the entire body. It's not only one area, the entire body. It affects throughout the entire body. So you not only hand and feet, and that is the reason why I want to make sure dive deep to let you understand this is a serious problem. It's not something as easy as you think. So now also the digestive problem we talk about is very important. You're going to feel constipated, you feel full all the time, feel bloating, slow your digestion because the nerve coming from your stomach slowly move the stool down and you feel nauseated. I have a patient come in, they told me, I went to the toilet 3 times, still don't come out. So frustrating. And they don't even want to go out outside the home because they can't make poop. So this is a psychological and also emotional issue. I don't want you to be in this boat. So you got to take care of blood sugar and take care of diet, a lot of fiber, you will have no problem with this. Why your feet also lose a feeling? Because the nerve damage first stand go to the feet, right? So any cut and blister, you can feel and start infected. You got ulcer. You know what? You end up amputating the feet. Like one of my patients that because can feel, they burn his toe and all that. It won't heal, and eventually, you know what? The foot has to be gone. So a lot of problems come in. Now, I tell you all these now. Well, how am I going to prevent this? Actually, prevention is very simple because you can just use food and help you support your healthy nerve. For example, you choose fish, take a lot of fish, and that is really help you, especially fishes like salmon, sardine. These are the fish that got a lot of omega-3, help fatty acids support the nerve and heart health, okay? They help you to nerve repair. Nut, seed, like almond nuts and all that. It's a healthy fat, magnesium, vitamin E, nutrition to help you maintain healthy nerve function. Beans, legume, kidney bean, give you plant protein, fiber, help you slow absorption sugar into the bloodstream so you don't get sugar spike. Whole grain provides steady energy to help you reduce large blood sugar spike compared with refined carbs. Okay, you don't want to do any refined carb. So healthy fat, when you cook, you got to use olive oil. No more flower seed oil, whatever oil. Use olive oil because it reduces inflammation. It supports cardiovascular health. So all these are helping the diabetic to build sustainable daily healthy habit. So net result, you don't get sugar spike. It continues lower your blood sugar. Now, one more thing, you got to drink low sugar tea. It does help you to lower your blood sugar, cholesterol, and blood pressure. If you can lower that down, you most likely you cut down all the diabetic risk and you become healthy. Now, what food I need to avoid? Now, that's something that is very important because I taught a lot of people, they really, at the end of the day, they start realizing you got to take care of not only, no more adding food with high blood sugar, soft drink like Coca-Cola, sweet coffee, cake, pastry, all that cut down. Now, you have to take cake. There's a lot of cake nowadays are low carb cakes. They're only 5 grams, or they don't even have carbs, or 2-gram carb. You can take that, but not in high amount. You have to highly refined carbohydrates like white bread, white rice, and many processed snack food. You cut that off. You take brown rice and you take red rice. All those things, not white bread and white rice anymore. And you have to cut down the food that contribute the sugar spike and inflammation. And so make sure that you will overwork a pancreas because where inflammation, a lot of sugar spike, the pancreas will put more insulin out for you. So you want to decrease that so no further, complication of diabetes. Now, deep fried food, which is a lot of French fry, all that stuff, cut that up because those are all cause inflammation and cardiovascular disease. So really, at the end of the day, it's very simple. So you drink more water. Instead of water, drink more low sugar tea and no sugary drink. You need whole grain bread, as we talk about. No more white bread, no more white rice, brown rice. You take real fresh fruit, which is like apple, pear, and nuts. Like you want to take like almond nuts and all that. So small little change. You can do it. I'm doing it. I know you can do it. It's easy to do. Now, you also need to change your daily habit that help you build healthy routine. Meaning you have to walk daily at least, first start 3,000 all the way up to 10,000 steps. Now, a lot of people say, I can't walk. No problem. Get a step master. Do the same thing. Do 10,000, 1 hour. Half an hour, 15 minutes, half an hour, and then you eventually move to 1 hour. If you say, I can't even do that, you stand on a chair with an arm rest on the side, just sit up and down, go up and down. You do the same thing for 100 times. You get the same effect. So this way you can get your strength exercise. You got a better sleep. You got to sleep 7 to 8 hours sleep, 7 to 8 hours sleep. Now you have to do stress management. You have to, in other words, You have decreased the stress. Take deep breath, all the time. Look out the yard, look at the green, and you're a healthy weight. If your BMI 30, go down to 23. Gotta do that. One more important thing, you gotta stop smoking, because smoking harden your blood vessels, and it's going to cause you more problem. And it also reduce oxygen go to all those valuable nerve. When you smoke, it decreases the oxygen go to the nerve, so further nerve damage. So don't smoke, okay? Stop smoking. Now, manage your blood sugars really matter. You gotta keep blood sugar in a healthy range. Like, for example, you have to protect your nerve. So every organ in your body depends on this healthy blood sugar vessel to the and also the nerve, right? So when your blood sugar remain within the healthy provider, the healthy range, meaning that you should have about 4, always stay with between under 6 to 4 range. That will be very good. Now you reduce your stress, you improve your circulation, you lower your inflammation, and you are now decreasing risk of complication, including involving your eyes, kidney, heart, and feet. In other words, all these things you do is actually really helping you the entire body, not only the blood sugar. Remember, you really at the end of the day, you became with diet control, your stable energy, you can have better mood, improve your blood sugar also, and you sleep well, 7 to 8 hours sleep. You now have good heart wealth. You protect your nerve, and basically with good dieting, low sugar, and plus at the end of the day, you also lower your weight. Now all that is actually help you to protect your nerve, improve your circulation, lower your inflammation, reduce all the diabetic complication. Now, when you actually need to see the doctor, like you said, I do all these, I don't know, man. Okay, when you see the doctor is when you have persistent numbness, it doesn't go away. Your burning pain doesn't go away. You start getting weak. Your foot start wound or blister, it doesn't heal. And you start to get a balance problem. Where you stand up, you kind of shaking, you don't feel the same anymore. And you have digestive problem that continues. Where you constipated 3 times after 3 you're still constipated. You need to go see a doctor, because you need more than your own, way of helping improve your health. Maybe at that time the doctor start checking you and start saying, hey, your blood sugar is very high, or you some meds to help you out. So that is something you must do. Now, really at the end of the day, you gotta continue to protect your nerve. That every day it requires consistency. You cannot just say, well, I do it for 1 week or 1 month. It doesn't work. Forget it. Because a lot of patients come back to me, hey, Andrew, you're so good. You helped me to cure my diabetes, or you cure my pre-diabetic because my blood sugar is real good now. And you know what? I said, no, I didn't cure you. Diabetic will never get well. You just need to do it all the time to decrease for a lifetime, to decrease the diabetic complication risk. And you have to continue. And these people, sometimes some continue, some don't believe me. They don't drink low sugar tea anymore. They don't exercise anymore. And now they go eat buffet every week. And that around 2-3 months came back, Andrew, your thing doesn't work. I said, yeah, because you didn't drink low sugar tea. You didn't exercise. You didn't try to diet anymore. So very important. You have to continue. What that means is you got to have a healthy diet. As I mentioned, you have to exercise. You have to stay hydrated. You have to drink 2 to 3 liters a day. Instead of drink water, drink low sugar tea, because you need the fluid to dilute the blood and dump the waste out, like the blood sugar, cholesterol, and blood pressure. If you don't drink enough water, you can't dump it out. You have to food check everything, make sure there's no blister, it's healthy. You have to have good sleep. You have to manage your stress, because stress actually increases blood sugar. Take deep breath and continue to monitor the blood sugar, 5.6 or lower. So if you can do all that, most likely you cut down all your diabetic complication. Now, why low sugar tea? Because low sugar, there are 2 things in there. Only thing is the bitter melon and guava leaf. Guava leaf delay the sugar going to the bloodstream. Bitter melon increase insulin sensitivity, take sugar back to the cells. Excess sugar, excess LDL cholesterol, and salt will dump out through the urine. They don't reabsorb. Salt went down, blood pressure went down. So all three high, blood sugar, cholesterol, and blood pressure will come down. So that's the reason why it's important to continue to drink low sugar tea. It's not a drug. You can take drugs with you all the time with low sugar tea. It does actually help you just a supplement. Now, we talk a lot and we talk it pretty fast. And importantly, I want to make sure that you need to have some really insight of this whole lecture, because this lecture will leave you 5 important messages. I hope that you remember all along to increase. You got to practice. This is a very powerful point. I think this is one of a really good lecture. I put all that together for you. The first, remember, pre-diabetic can only have, it's not pre-diabetic can already affect your nerve. It's not like, I will buy diabetic, the nerve will come later. No, many thinking actually is really misconception. You really need to take care of your nerve early. Many people think complication later is not true. It is always basically it will start elevated blood sugar level, and then they begin just changing, damaging the nerve, and the nerve because the tiny blood vessel. Remember the tiny blood vessels that sending signal to the or giving nutrition, oxygen to the nerve, and this thing will start damaging. And when that's damaged, meaning that you're going to start feeling tingling, numbness, burning sensation, and occasional pain. And too bad is a lot of time. Sometimes this come in and it really a few little time it go disappear. So it doesn't mean the nerve is not continue to be damaged. It's continued damage. So if that's happened, you need to continue to monitor it. If it's continuous existent, you got to see a doctor. And it really, at the end of the day, if you don't take care of it and you don't take care of all your lower blood sugar, you know what? You become a type 2 diabetic. And so that's why it's so important to continue to lower your blood sugar. And second is that diabetic high blood sugar can damage nerve over time. And diabetes are leading the cause of peripheral nerve damage, peripheral neuropathy, or they call peripheral nerve damage on the area. Like we'll be going to, especially many years going diabetic 3-4 years, it start affecting more and more your hand, your feet. It start usually the feet first, and then eventually your hand. And then eventually affect the digestion. You got constipation, you have bladder issue, your heart issue, your blood pressure issue, and many other automatic body function. This is why diabetic is about more than not only glucose matter. It affects your entire body. The more important is entire body. And net result, you're going to have very difficult down the road, your independent issue as you go on, because you can't balance, can't walk. And the third, diabetic nerve damage often develop gradually. So early sign you might not understand, you may ignore. So you have to listen to your body. If you experience tingling, feeling, pain, needle burning, numbness, muscle weakness, poor balance, constipation, all these things, you can't assume that is because of old age. It's not. You have to, this early sign, you need to go to the doctor and start asking, hey, what is this? How can I improve this? And the fourth, you are currently understand if you are pre-diabetic diabetes, you have no cure. It's only you can control either through your lifestyle change, eating balanced meal, rich vegetable, low lean protein, healthy fat, fiber, help you to get normal and drink low sugar tea. If you can do all that, you will able to be more successful, lower your blood sugar, cholesterol, and blood pressure. You have better chance to become less chance to get diabetic complication or change your diabetic. Now, finally, healthy blood sugar really can help you decrease the fifth diabetic complication. So you have to keep your blood sugar within a healthy range. Your A1C has to be between 5.7 to 6.4. Continue to do that, because if you don't, you affect your nerve, you affect your eye, your kidney, your heart, your blood vessel, and you can reduce the risk. You can reduce if you put blood glucose control. You reduce the chances you get food ulcer, infection, fall, vision loss, all these things. You can prevent it. So all that really require you to do healthy meal, walk every day after dinner, or do leg exercise, step master, a good night's sleep, also every day good blood sugar check, and every possible way to change your lifestyle to be a really good lower the blood sugar lifestyle. So today, I hope that we can give you an overall, a very, I know it's very quick, but I think today the lecture is so important to help you to better understand nerve damage is not something that you can take it lightly. You got to really take care with, what I talked to you today. Lower your blood sugar through the lifestyle change. Even you are pre-diabetic or diabetes, doesn't matter. You got to get the start. Start today. Healthy blood sugar is help you to reduce your diabetic complication. And remember, drink low sugar tea. So today, as my lecture, I hope that will give you a good overall lecture to give you understand. If you have any question, write to me, Andy@wildfarm.com. It's so important to write to me. A lot of patients come back and give me feedback. Yesterday, constipation lecture, whoa, there's so many comments will say it really helped them a lot. And that's really true. And so you can also WhatsApp me 852-6792-8891. Okay. So anyway, today's lecture is basically give you an overall concept. What is nerve damage? It's easy to understand. And I think the doctor do not explain that much information for you. But today I thought I gave it to you. You can able to get this understand easily. So looking forward to see you next week. Another good lecture. So take care. I hope you enjoy a good weekend. Again, good drink low sugar tea and help you to continue exercise, low fat, low carb diet, a lot of fibers, and lower your weight. You will be much healthier. Take care. Bye-bye.